everyone. I'm Heidi Murkoff, and I am so excited to welcome to our What to Expect family someone who has spent his entire career as a champion of public health, which is my personal favorite kind of health. He's also returning champion of Surgeon Generals. He served first under the Obama administration and now under President Biden. And his most important credential in my book, he's the dad of two littles, aged 3 and 5, right?
That's right. Yeah.
So welcome, Dr. Vivek Murthy. We are so happy to have you on.
Well, thank you so much, Heidi. I just want to acknowledge the incredible job that expectant parents and parents have done during this pandemic. I mean, Heidi and I were just saying it wasn't like it was easy before to be expecting a child or to be raising young children, but it has gotten so tough during the pandemic, dealing with the uncertainty, trying to figure out how to keep your kids safe, trying to figure out how to keep yourself safe so you can be there for them. And so I just think parents have done such a heroic job during this time. And I just want to tip my hat to all of you who are finding a way to make it work during difficult times. And hopefully you're supporting each other, because I'm finding my wife and we're trying to figure things out with our kids that without a community of parents kind of having our backs and lifting us up when we feel like we're failing, it would have been pretty tough to get through the last 2 years.
You know, it's funny because I was going to ask you at the end, but you started with that for parental pep talk, which I think we all need. And I really appreciate you starting off with that. We all need to get together and paddle our way out of this. So I appreciate that. It's never easy being pregnant. It's never easy being a parent. It's just become exponentially harder. And part of the struggle that's real is figuring out what kind of mask we should wear. It's nobody's favorite subject. And we're 2 years into it. And I can safely say pretty much everybody is over it, but mask we must, and for everybody's safety. So what are the latest guidelines about masks?
Yeah, it's a great question. And I think we're all excited about the day when we can get rid of our masks and go back to just being fully faced, if you will, with each other. And hopefully that day will come soon. So a couple of things to know, though, about masks. So one is, of course, if you're in your own home with members of your household, those are not circumstances where you have to wear a mask. If you are also outside, let's say taking a walk with a friend or just having a picnic in the park, that's also not a circumstance where you necessarily need to wear a mask. The places where you need masks are when you're in indoor settings, not in your house, but in other places. Like, let's say you're gathering with friends at somebody else's house. You're together with people outside of your household in an indoor setting. That's the time where you need masks. And in terms of the outdoors, I would say the circumstance where you might consider a mask in an outdoor setting is when you're in really crowded quarters for a long period of time. And so if that's going to be the case, then you might want to go the extra mile and wear a mask there. So then the question becomes what kind of mask to wear. And here's where Omicron has shifted things a bit in terms of the importance of wearing a high quality mask. So the first thing to start with is just to recognize that a mask is better than no mask, for sure. And masking, it does two things. One, it helps prevent infection from traveling from you to someone else. And a good quality mask can also help protect you as well from infection that may be spread from other people. Now, because Omicron is so contagious, it's made it more important than ever to wear a high quality mask. So what is a high quality mask? Well, there's a ladder, if you will. The no value is no mask, right? A step above that would be a cloth mask. And if you wear a well-fitting cloth mask that you can tolerate and wear for as long as you're in that public indoor setting, then that can give you some level of protection. You can increase the protection by moving to a surgical mask, which gives you better filtration. Again, just make sure it fits you and fits you well. Right. And a step above that would be a KN95 or KF94 mask. You may have seen these, heard about them. And N95 masks are sort of the highest level of protection that you have. Now, there are masks that doctors and nurses wear in the hospital setting where they wear N95s and they get fit tested for it and all that. You don't necessarily need to do that on the outside. Even wearing a non-fitted, N95 mask will still give you a good amount of protection. And finally, just think about this, like when should you reach for those higher quality masks? Well, I think it's especially important if you yourself are in a higher risk category, maybe based on your age or your other medical conditions. It's important if you live with somebody at home who might be higher risk or who might be like my 4-year-old daughter unvaccinated because she's not yet eligible. That might be a circumstance where when you go outside, and are in other public indoor settings, you might want to wear a higher quality mask so you don't bring infection back to the vulnerable folks at home. And the final circumstance is if you're going to be in an indoor setting for a long period of time with people who may or may not be wearing masks, let's say you work in a grocery store or in another setting where you're going to be around people for a long time, can't control whether they're wearing masks or not, that might be a circumstance where the quality of your mask makes a big difference. I should actually just tell you one more thing about kids. And look, when it comes to kids and masks, I'll tell you, every day my wife and I are thinking about this with our kids. We send them off to school. We're checking to see, are you actually able to wear your mask, or are you using it like a napkin? What are you doing with your mask? And we have to remind our kids sometimes.
They don't use napkins. You know that. So
yeah, what's either their sleeve or their mask or something else. At least that's our kids. But what's important with your kids is most importantly, just to make sure that they're wearing a mask that fits them well, that they can tolerate. If your child doesn't tolerate the mask, if it's too uncomfortable, they're just going to pull it off and we're not going to wear it properly and it's not going to serve its purpose. And if that ends up being a good cloth mask, and that's what's comfortable, that's what they can wear, then that's fine. I know that some schools are offering KN95 masks or KF94 masks. I know that our school, in fact, has offered that to some of the children, and some kids are taking them up on it and wearing them. Again, it's got to be comfortable for your child. They have to be able to tolerate it. So what I would finally say for kids is that the highest quality mask that they can tolerate is what you should do. There aren't really N95 masks at this point for children. N95 is sort of a NIOSH standard. Right. That's the National Institute for Occupational Safety and Health. And they're primarily made for adults. But other than that, the other masks, KF94s, KN95s, surgicals, and clots, those come in sizes that are available for children.
And, I have to say, from my experience, kids are way better about following mask mandates than a lot of adults are. And I kind of think it's like, because they have this idea when something is non-negotiable, that's the first rule of parenting. Things that you want to be non-negotiable, keep non-negotiable, don't negotiate, like car seats and seatbelts. And I think they realize that when something is non-negotiable, then you follow that rule. And so I think kids have been pretty amazing when it comes to mask wearing. Even our 3-year-old grandson, it's like a champ.
Yeah, it's really remarkable how resilient kids can be and also just how adaptive they are. It's surprised me. Like sometimes my son, when he sees people who are indoors and not wearing a mask, he kind of tugs on my shirt and he points at them, like asking why aren't they wearing a mask? So it's surprising. But I'm glad you mentioned the age also, because age does matter here. We aren't actually recommending that kids under 2 wear masks because we don't want it to interfere with with their function, with their breathing, or for it to be uncomfortable for them in a way that they can't intervene and pull the mask away if it's causing them any trouble. So this is for kids that are older, that are above 2
and over. So let's talk about vaccines, a subject you may have talked about once or twice.
Just a little.
Yeah. Probably the concern that we hear the most when it comes to vaccine safety from our What to Expect community is about, and I think this is probably due to a lot of misinformation that has been circulating about the impact of vaccines on fertility. Can you speak to the concern and also to the misinformation that's out there, especially for those who are planning pregnancy, maybe not tomorrow, but in the next year, and are concerned about that?
Absolutely. I'm really glad you asked this question, Heidi, because you're absolutely right. This has been the subject of a lot of questions and conversation from people. And some of it, unfortunately, stems from, I think, some rumors and misinformation that's been circulating on the internet. And look, if you've seen some of this and you haven't been sure if you're actually reading facts or fiction here, don't feel bad. It's sometimes really hard to tell what's true and what's not when you're reading it online. And sometimes well-intentioned friends and family members will send you things that maybe aren't true, but they think they're trying to help you. So let's just dig into what the facts are right now. It turns out that when this has actually been studied very carefully, the impact of the vaccines, on getting pregnant, on people during pregnancy, and on breastfeeding after pregnancy. And the bottom line is there is no evidence that the vaccines cause fertility problems or problems during pregnancy or problems after pregnancy. The NIH, the National Institutes of Health, their researchers have in fact done studies and looked at data in this area, and they found no differences in the chances of conception if either the male or female partner had been vaccinated when comparing them to unvaccinated couples. Interestingly, one of the things they did find is that couples did have a slightly lower chance of conception if the male partner had been infected with SARS-CoV-2 or with COVID-19 recently, before they were trying to get pregnant. And so that's interesting, and it points to one other thing that's really important to clarify here, which is that as much focus as there's been or questions about the impact of the vaccine on conception and on pregnancy, what we aren't actually talking enough about is the impact of COVID itself on people who are pregnant. And this is where the more and more data we find and the more studies we do, we recognize that COVID, that if you are pregnant and you get COVID, you are at an increased risk for bad outcomes. So it's in fact, not only is the vaccine not associated with fertility or pregnancy-related problems, it's all the more important for you to get vaccinated if you are pregnant or if you are trying to become pregnant, because we have seen that among pregnant people who get COVID, their chances of ending up in the hospital or the ICU are significantly higher, and their risk of preterm labor or preterm birth is also higher compared to people who are pregnant and who do not get infected with COVID-19. So all of that to say that the data points to the vaccines being safe during these various stages before pregnancy and during pregnancy, but it does point to COVID-19 being a risk factor or being a factor in bad outcomes, worse outcomes, if you are pregnant. So all the more important for you to get vaccinated if you're trying to get pregnant or if you are pregnant right now.
And that's true of flu as well. Pregnant women are more likely to end up hospitalized if they get the flu when they're pregnant. So I just want to put in a little plug for getting the flu vaccine as well during pregnancy.
Yeah, and it's a really good point, Heidi, because it does seem that pregnancy is a time where you are a little bit more susceptible to certain infections, particularly respiratory infections. And these infections, even if you're not pregnant, can sometimes do a number on our bodies. But during pregnancy, that's a time where where your immune system actually is functioning a bit differently than when you're not in a pregnant state. And sometimes it can create greater risk for infections, which can then have complications for the mother and for the developing baby. So getting your vaccinations, whether it's for COVID, whether it's flu, or the other recommended vaccines during pregnancy, is really critically important.
We'll do another one on Tdap next time.
Sure. Yeah, absolutely.
Is there a lot of moms have asked me if there's a best time to get vaccinated or boosted when you're pregnant. Some worry about getting it first thing in the first trimester. Everybody worries more about everything in the first trimester, understandably. But give us the facts on that if you could.
Well, listen, I can certainly understand this. My kids are young enough that it's still very crystal clear in my memory what it was like when my wife was pregnant. And she was fine. I was the one who was worried about everything that she was doing, that she was eating.
Don't sleep on your back. Don't touch that cheese. You don't know if it's pasteurized, right?
Yeah, I worry I may have contributed more to her stress than relieved it, which I feel bad about. But so it goes. And I think it's appropriate for people to ask these questions. The good news is that when the CDC has closely looked at the data as to when people do get the vaccine in the first trimester, second, third, et cetera, and is one associated with better or worse outcomes than the other, they found generally that any time during your pregnancy getting the vaccine is actually fine. And that's why their recommendation is just to get it whenever you'd like, but ideally as soon as possible. Because keep in mind, if you get COVID during pregnancy, you are at greater risk for worse outcomes, and your baby's also at greater risk of bad outcomes. So getting the protection started early is really important. And this is not just true for COVID vaccines, this is true for the flu vaccine as well.
And that's true also of getting a booster. So say you had your 2 vaccines before you got pregnant, and now you found out you're pregnant, the appropriate amount of time has elapsed, go out and get your booster, correct?
That's right. Yeah, absolutely. So for everyone who's wondering when to get a booster, if you got your Pfizer or Moderna vaccines 5 months ago or more, you can get your booster shot, and you should get it as soon as you can. If you got your Johnson & Johnson vaccine, more than 2 months ago, then you're also eligible for a booster shot. So with Omicron in particular, it's all the more important that people get boosted, because interesting what we're seeing is that Omicron, unlike the versions of COVID that came before it, it does have the ability to evade some of our immune defenses, some, not all. But if you get boosted, that actually significantly raises your protection. In fact, the booster shot in a recent study that came out of the CDC showed that people who are boosted have 90% protection against hospitalization and 82% protection against visits to the emergency room or to urgent care. So that's pretty good as far as vaccines go, but that's why that booster is so important.
Raising both hands, boosted here.
Oh, good.
Oh, yeah,
Me too.
For sure. I was the first in line. What about the antibodies that moms might be able to provide their babies if they are vaccinated during pregnancy?
Yeah, well, that's a really important question as well, because as many people may know, moms can pass antibodies through the placenta to their babies, which is very important. And those can, give the babies protection for the first few weeks to months. And there's also antibodies that you pass on actually through breast milk, which is also another important layer of protection that kids can get. In addition to all of that, though, it's still very important that you get the vaccines that are recommended by your pediatrician for your child, because when you put all these together, that's how we really maximize the protection for our kids. But that's, again, why these vaccines are important for the mother as well, because when you build those antibodies up, that's an added layer of protection that you can pass on and share with your developing baby and with your baby after your baby's born.
And you're protecting for two. So you want to take every layer of protection that you can get. Definitely. So
that's right. And lastly, just on that, Heidi, there's a practical point that and that most people on this call know, but I just want to make it explicit, which is that even apart from the antibody issue, if you end up falling sick, like in the first, a few weeks or months, after you give birth, that's an incredibly hard time to fall sick. It's as it is, you've got so much on your hands. You're probably not sleeping enough. You're trying to keep up with everything, and being sick on top of all of that just makes life so much harder. I do want to say that you've probably heard of people who have gotten vaccinated for COVID-19 and who have tested positive anyway. And that is happening, especially with Omicron. We know that there are more what they call these breakthrough infections, but there's a big difference in that people who are vaccinated and especially boosted who get infected, who test positive anyway, they tend to have mild cases of infection that mild in terms of less severe and also last for a shorter period of time, which is really important when you're trying to care for a newborn child. Every day counts that you're sick and out of the game, right? And so yet another reason why getting vaccinated is helpful. It can help make sure that you stay in a good place, that you stay healthy, that you stay on your feet, so you can also care for your child.
And I think it's also important to point out that you can breastfeed if you test positive for COVID. There are just more protection layers to use, including a mask, but you would be doing that if you were bottle feeding as well. And you're able to pass along those antibodies if you're breastfeeding while you're COVID positive.
Yeah, and absolutely. And I know that people have had questions also just about the vaccine and breastfeeding. Yeah. Can you get the vaccine? Can you breastfeed? And the answer is yes. You can get vaccinated, you can breastfeed, and the antibodies you develop, through the vaccine, or if you had prior infection, if you have antibodies, those are antibodies you can pass on through the breast milk to your baby.
And the same thing for your Tdap vaccine and also your flu vaccine. So yet another reason to roll up your sleeve and get in line. Are there pregnant women who are more at risk from COVID than other pregnant women who have gestational diabetes or hypertension? Would that be a reason to be extra cautious?
Yes, well, we know that having certain underlying conditions like the ones you mentioned, heart disease or diabetes, these can increase your risk of having bad outcomes with COVID-19. And so I would say, and certainly if you're immunocompromised in some way because of another illness, that can also significantly increase your risk. So it makes sense, in those cases, not only to get vaccinated and boosted, but to go the extra mile and to take precautions like wearing a high quality mask. If you are really worried about your health, if you're immunocompromised, for example, or have other complicated medical conditions, you may also want to be thoughtful about the kind of activities you engage in and choose to take, lesser risk, especially during the time of your pregnancy. So again, this is going to be tailored to each person, but certainly we have seen over the last 2 years that other medical conditions like diabetes, obesity, heart disease, lung disease, these are associated with worse outcomes with COVID-19.
Okay, now let's skip to the good part. Your baby, right? You bring that bundle of joy home. I think you probably were there as you were there as a nervous pregnant father. And I'm sure, being a health professional doesn't make you immune to being nervous when you have a baby, not even if you're a pediatrician. So you worry about every little germ that might come your baby's way. That's normal. They seem so vulnerable and so tiny. So what are some of the best ways to protect your newborn from COVID-19? Of course, you should get vaccinated. Of course, both parents should get vaccinated, and any older siblings in the home, and also anybody who cares for your child. But should parents keep their baby in a bubble? We're all tempted to, or even in a wrap, because then nobody can hold your baby except you. I think actually that's a great idea, to wrap your baby up and wear your baby. But what about visitors, especially those eager and doting grandparents? What do you think?
I was just going to say, I think there might be more than one grandparent who would be willing to fight the parents if they try to keep the babies away from them. I know certainly my parents, my wife's parents would have gone to the mat there. But look, I think it's a natural instinct, obviously, to want to protect your newborn. And we know that even though babies and young children are at less risk for bad outcomes with COVID-19 compared to older adults, we also know that newborns don't have yet fully developed immune systems, and they are in a vulnerable state, if you will. And so because of this, I think there are certain layers of precautions that are worth considering and taking around babies. So number one, as you mentioned, is to make sure that the people around the babies are up to date on their routine vaccines, not just COVID-19, but also Tdap, flu, and other routine vaccines. And you should ideally get the vaccine at least 2 weeks before coming into contact with the baby, because that gives your body time to build protection and reaction to the vaccine. The other thing is, if you can gather with people who don't live with you in either well-ventilated indoor settings or outdoors, that also reduces the risk of infection being transmitted. Masks are also important here. People often want to hold a baby, get close to a baby, and that's certainly a much lower risk if the person is wearing a high-quality mask when they are doing so. And make sure they're wearing it properly. There are a lot of people, unfortunately, who are wearing masks below their nose and even below their mouth. I'll tell you, the chin diaper doesn't do a whole lot for COVID protection. So just make sure people are wearing it and wearing it well. There's one last layer of protection you may consider, and that's testing, which is, you can now with the increasing availability of rapid home tests, one thing you can also do is have people do a rapid home test before they come over, or before they actually have contact with the baby. None of these layers of precaution are 100%, but when you layer them together, it's kind of like a Swiss cheese model. It's like, each layer of Swiss cheese has some holes in them, but when you put them against each other, they can form a pretty good seal.
Oh my goodness. I never heard of the Swiss cheese model, but yeah, you're absolutely right about that. So we're not wrapping babies in Swiss cheese, however. Just want to make that clear.
Definitely not recommending that.
No cheese until at least after 6 months. If grandparents are not fully vaccinated, is it hands off the merchandise?
Well, I never want to say keep a grandparent away from their child. It's up to really each person to make these individual decisions based on risk. Like you have to think about not just a person's vaccination status, but what is their level of exposure on the outside? Are they out and about engaging with lots of people who may or may not be protected with vaccines or masks? That might increase your likelihood of being infected. If they are not vaccinated, but they're willing to wear a mask and test, before they come over, that'll lower your risk even further. And so everyone has to find their right comfort level with these, but taking as many of the layers of precaution and implementing them as possible just allows you to maximize how much you reduce your risk.
I like to think of it as cocooning your baby. And if everybody around you can help with that cocooning process, that's probably the best way, better than a bubble. I like cocooning. Not
Bubbles
Swiss.
can get lonely.
Yeah, bubbles can get lonely, and Swiss cheese can melt. So yeah. Okay, great. Now we're moving up to kids. And so, by the way, happy birthday to your 4-year-old, who's no longer a 3-year-old, which I said
Thank
earlier
you.
on. So now you have a 4-year-old and a 5-year-old, or a 4-year-old and a.
Yeah, my daughter's birthday, she's turning 4 on January 28th. She's
Oh,
incredibly excited about it. And
wow.
she's wasted no time in telling us exactly what kind of cake she wants for her birthday, which is chocolate cake with chocolate icing. And I think she's even asked for chocolate decorations. So we're looking for those.
Oh, chocolate decorations. Yeah, some Willy Wonka kind of elements.
That's right.
That would be great. Well, chocolate's good for your health anyway. So you have a child who is vaccinated. Your son is vaccinated, correct?
Yeah, that's right.
And you and your wife's also a physician, I might add. You decided to have him vaccinated as soon as he was eligible, right? And
That's right.
so I'm wondering, why are you so confident that vaccination was safe for him as a father, as a physician? And can you explain why other parents should be confident as well? Because I feel like we always got to start with the premise that every parent wants to keep their child healthy and safe, and no parent knowingly does anything to harm their child. It's just that sometimes they've heard something that's not true, some misinformation that has trickled down. So can you just make us talk parents off the ledge and kind of explain why it's safe to get your child vaccinated if they're 5 or older?
Absolutely, Heidi. Listen, I think where you started is exactly right. Every parent out there wants the best for their kids. They want to protect their children. That's what unites us as parents, and that's what connects us,
Exactly.
I think, to a long lineage of parents over thousands of years who have looked out instinctively, intuitively for the well-being of their kids. And this moment is no different. We've got to do that with COVID-19 as well. Here's how I thought about the vaccines. And I'll say that even though I serve as Surgeon General, even though I'm a doctor, I'm still first and foremost a dad. I'm a parent, and that's how I think about my kids. If I didn't think the vaccine was safe for my kids, I would absolutely not give it to them, regardless of what anybody else said.
Yes.
But here's how my wife and I thought about this. So, number one, we looked at the vaccine itself, right? And we asked the question, is this effective for our kids?
Mm-hmm.
And is it safe for our kids? Both things were very, very important. And we looked ourselves at the clinical trial data. And what we saw is that in the clinical trials, that about 90% protection is what kids got who had this vaccine in the 5 to 11 age category. And that's pretty good, actually, as far as vaccines don't go. You don't always get that high level of protection. Oh. But the other thing that we saw was the safety profile was actually pretty good. In fact, the side effects that kids had tended to be like a sore arm at the site where they got the injection, maybe a low-grade fever, some body ache, headaches. But those lasted typically 1 to 2 days, and then they were gone. And what the children were left with was this protection, this 90% protection, if you will, from infection. So that actually made us feel good. The second thing we looked at was the process. How was this data actually vetted? Who looked at it? Were any corners cut? And this is where, in part, because of my job and working closely with the FDA, I've been able to talk with a lot of the people there who are involved in the evaluation of this data. And I can tell you that while they hold the COVID-19 vaccines as their top priority, they want to get them to people as fast as possible, they also know just how much the public depends on them to know whether something is safe and effective. So there is no way that they were going to cut corners in their evaluation. So the evaluation was done by scientists within the Food and Drug Administration. It was also looked at by scientists within the CDC, the Centers for Disease Control and Prevention. And then they were independent scientists who advised both the FDA and CDC, but were not part of government, who also looked at the data to see whether this was in fact safe and effective. What I'm talking about seems like a lot of layers of review, it's because there were a lot of layers of review.
Yeah.
And that was reassuring to my wife and to me when we were looking at this. So when we put it all together, that made us feel comfortable with the vaccine. There was one last thing we considered, which is what's the cost of not getting vaccinated, right? Because if it wasn't a big deal not to get vaccinated, then we might have said, why do it? But then we looked around us, and because my wife also works on issues related to COVID, she also knows the data very well, which is helpful for me because she's a lot smarter than me, and it's good to marry up. And I definitely did that. And so I get advice for her all the time on these issues. But what she told me, and what I also was able to observe looking at the data myself, is that kids, while they do better than older adults, they aren't untouched by this virus. We've had millions of children who've gotten infected and thousands who have ended up in the hospital. And we've seen that particularly during Omicron, which has been so incredibly contagious. We've also lost hundreds of children to this virus. And you might think, well, that's only a fraction of what we've lost compared to adults. But I'll tell you this, we give vaccines to children for illnesses that cost us much fewer lives than COVID-19 has cost our kids. Much fewer lives. So the question of have we hit the threshold where a child needs to be vaccinated from COVID-19? The answer is absolutely yes, based on how we've treated other illnesses and what we vaccinate our kids for in other circumstances. So when we put all that together, we said, well, if there's a risk to our child, even though it's less than to adults, if we can minimize that risk even further by giving our child a vaccine that's safe and proven to be effective, then we want to do that. And so we talked it over, we made the decision, we got our son vaccinated. And it's also had some spillover benefits too. Like, it's when it comes to quarantine, if you're vaccinated, it makes your quarantine period easier. You don't have to actually quarantine, you wear a mask, until you test out negative, but it's easier for kids, especially with school. It also made us feel, just from a peace of mind perspective, I got to tell you, it's made a difference in how comfortable we feel with our child getting together on play dates with other kids. So those are the reasons why we did it. I understand this is a personal decision, though, for every parent. And so don't ever feel bad if you have questions. You should ask those questions and make sure you're hearing from trusted sources. And if you're not sure who to trust, just remember, you can always talk to your own doctor, but don't always believe everything you read on the internet or on social media. Even well-intentioned people often can share things that may or may not be accurate.
Right. And definitely talk to your pediatrician, because your pediatrician knows your child in addition to knowing about COVID. And that's really important. You know your child, but so does your pediatrician. And working together in that partnership, asking all the questions that you have is so important in keeping your child safe.
That's right.
I wouldn't want to do it alone, go it alone as a parent. And I feel I always had partnerships with the pediatricians that made it so much easier. That your child, they know the medicine, put it together, you got something really helpful and beneficial. So there have been clearly lots of news reports about Omicron and kids and hospitalization. Is there anything else that parents need to know about this variant?
Well, the most important thing to know about Omicron is that it is an incredibly contagious version of COVID-19. And the reason that matters is because even though there are some reports that indicate it likely is milder, that it's less severe than other versions of COVID-19, the fact is, because it is spreading so fast and affecting so many more people, we're actually ending up with more people in the hospital than we had with the original wave of COVID-19 and with subsequent waves. We, in fact, broke our hospitalization record during this Omicron wave, exceeding 150,000 hospitalizations. Now, those included many children. Yeah. And, again, as the dad of a young child who is not eligible yet to be vaccinated, my almost 4-year-old, I know that this is tough for parents out there who are waiting for a vaccine and who think, gosh, if the unvaccinated are more vulnerable, then what do I do? How do I protect my child? And so the measures that we have talked about that I know all of you have heard about that are so important to protect and reduce spread, from wearing masks to the vaccines and the boosters, to surrounding your children with people who are vaccinated, to using testing strategically, gathering in well-ventilated places. These are all the more important during Omicron. And so it breaks my heart to see hospitals that are taking in record numbers of children because of Omicron. And so again, even though you hear that it's less severe does not mean that it's mild or harmless. Even if a small portion of children end up in the hospital, because so many children are being infected, that ends up translating to far more kids than we want. Certainly in the hospital, because we don't want any kids in the hospital.
We don't want any kids in the hospital. We certainly don't want any kids to die.
Yeah, and now in particular, if you've got a child who's 5 or above, the heartbreaking part is when I talk to doctors in children's hospitals around the country, what they tell me is that the children that they are seeing are predominantly unvaccinated. Now, if you're under 5, of course, there's no vaccine yet available for those children. And that's why we're doing all these layers of precautions so important to protect those kids. But for kids 5 and up, there is a vaccine available. And I know that, that we've had millions of children actually get vaccinated, but my worry is we're still somewhere around 20% of kids in that 5 through 11 age group who are fully vaccinated. That's not nearly enough. We got to get more kids protected. And when you look at what's happening in the hospitals, that you can't escape the conclusion that, gosh, a lot of these may have been prevented. A lot of these hospitalizations of children, if we've been able to get them vaccinated. So I would just urge parents, if you haven't yet vaccinated your child, please strongly consider it. It's a decision certainly my wife and I made. That's what was right for us. I hope you'll take a good look at the data, that you'll talk to your pediatrician or your family physician and find out what you need to make that decision, because it could really prevent your child from getting seriously ill.
That's such an important message. And the same is true of pregnant women. They have, as a group, had lower rates of vaccination than other women their age. And I feel it's incredibly important because we could prevent a lot of hospitalizations for pregnant women as well. And I know you're one of these parents, but when you're anxiously waiting for the vaccine to be available for children under 5, I know I am. I know so many parents who are. Do you have any sense at all? I know you can't give me a date, but do you have a sense of when we might expect to see some sort of recommendation on that?
Yeah, and I wish I could give you an exact date. The reason I can't is not because I'm bound by secrecy. It's because I legitimately don't know. We don't know yet collectively. But here's what I can tell you. I can tell you that the trials looking at vaccines for kids 6 months up to 5 years of age, these trials are actually underway and have been underway. Yeah. And we are anticipating that later in the spring that we should get data from those trials. The FDA is standing by ready to look at that data, to share it with its outside scientists who can provide an independent assessment of the data. The CDC is also ready and waiting for that data. Everyone is ready to act as soon as the companies finish the trials and submit that data. So I'm anticipating that if the trials go as scheduled, that later in the spring is when we should have some results from that trial. I'll tell you, it can't come soon enough because we're just chomping at the bit, my wife and I, to get our 4-year-old vaccinated. She's also wondering why her brother got stickers for getting vaccinated and she hasn't gotten stickers. So we have a lot of explaining to do here, but it would be much easier if we could just get her vaccinated.
No fair. So actually that brings up one of my questions, really important one is, did your son get ice cream after the vaccine? Was there a treat involved?
There were multiple treats involved because we had to, my son does not like needles. He's like his father in that regard. And so while we were able to get him,
receiving end of them.
Yes, I have certainly administered many shots, but I do not like getting them myself. I can roll up my sleeve and I do it when I need to, but I don't love it. And he doesn't love it either. So he was fine for the first shot. But the second shot, he kind of wised up to what was going on. So we had to, we realized, even though he's only 5, he's a pretty skilled negotiator. So he negotiated several treats in order to finally walk in to the room with the nurse where the shot was being administered. And then he got it.
Okay. So you don't have to divulge what the treats were because, some things you are bound to see.
No, I can tell you we had to give him ice cream and we had to give him a popsicle. Those are the 2 treats. And that was in addition to the lollipop that he got from the nurse who gave him the vaccine. So he really he extracted quite a lot of return for that.
Yes,
shot.
he did. Wait till he's
probably doesn't say anything good about my parenting skills, but that's real life. So
no. Parents got to do what a parent's got to do. Actually, Lennox, our 8-year-old grandson, when he got vaccinated, the pharmacy happened to give out churros to all kids getting vaccinated.
Oh, wow.
Coincidentally, he doesn't like anything, but he loves churros. So not just his first, but his second, he got his churros and he was a happy, happy camper. So
that's great. Whatever works.
Whatever it takes. So I just want to close and if you have something else you would like to say about how you gave us your pep talk, Like, is there a light at the end of the tunnel? Parents, hold on. Help is on the way. We're all in this together. All of the usual. Anything you'd like to add?
Well, I do want to say, look, I know I said this early on, but I just want to underscore it, just how much I appreciate what parents are doing during these rough 2 years. I think a lot of that, the strain and pain that parents have taken on has been invisible to much of the community and the country. I don't think as a country we fully appreciated what parents did to begin with in pre-pandemic times, how they had to balance work and school requirements and obligations and all of the other things that raising a child well requires. It's tough work. It's hard work, even if you weren't working. It's tough work if you are working. It's just hard work. And I think as a society, I think we've undervalued that. And I think it's become even more apparent to me during this pandemic. And so, one, I just want to say to parents out there that I see you. I know what parents are going through. I know we are all in unique circumstances, but I know we are all going through a lot. And I just want to say how much I appreciate you hanging in there and continuing to take care of kids in our communities. I also do want to say that I believe sincerely that there is, in fact, a light at the end of this tunnel. I do feel more hopeful now than I did 6 months ago, and even more hopeful than a year ago that we can get there. Because to me, the getting there doesn't mean that COVID disappears, like poof, and it's gone forever. What it means is that we get to a steady state where we're able to manage this virus like any other respiratory virus. And we do that with a combination of vaccines and boosters, but also medications that can knock down the severity of the virus, even if you do get sick. The good news is we have more of those medications in this month in January than we've had in any other month of the pandemic, but we need even more of them so that they're available to anybody who wants them at any time, in any place. So that is what we have to do. And as we get smarter about this, I believe that we will be able to dial up and dial down our precautions based on when the circumstances require it. So if we see a more dangerous variant on the horizon, okay, then that might be the time where we ratchet up our use of masks and we strategically use testing. But as soon as that recedes, then we know when to pull back on that. We can go about living our lives in ways that we've missed really for the last 2 years, but that are really important and meaningful to us, keeping our kids in school, being able to go to work ourselves, being able to see our friends, being able to go to ball games, being able to get together with families for reunions and for weddings. These are a lot of things people have missed out on, but I really believe we can get them back. We can do them much more safely than we could have 2 years ago already today. And we will only get better at doing this, as we learn more in the weeks and months ahead. So I do feel hopeful about the future. I know this is not a good time, though, given how many cases and hospitalizations we have because of Omicron. But I do think we will get through this. We just have to stick together. We have to support one another. And this is where, again, reaching out to other parents, other families, just to check on them from time to time. I can't tell you what a world of difference that makes, because this parenting journey, as all of you know well, can feel really lonely, especially during a pandemic like this.
Oh, absolutely. Yeah, I feel like it's been incredibly challenging, and just knowing other people are going through the same experience at the same time, and that you're not alone, and that you can ask for help within your community, even if it's virtually, it really goes a long way. But speaking of things that we've missed, I make no secret of the fact that what I miss the most is what I feel like I'm the best at, and that's hugging. I have missed, on a good day, I would give 1,000, 3,000 hugs, all over the world I've hugged. And that's probably my favorite thing to do. And I've missed it. I've missed, of course, I still hug family in my pod, but I've missed hugging strangers, who I've just met. And just so you know, you owe me a hug. You will pay up. Just, it's a matter of time. But yeah, I miss hugging a lot. I have a 1 hug minimum, no maximum in my line of work. But I wanted to ask what you miss the most during this pandemic and what you look forward to the most.
It's a really good question. I think I love hugs as well. And my wife does too. We're both big huggers.
Oh,
and so
we'll get along great.
Yeah, I've certainly missed that. The other thing I really miss, though, is honestly just having dinners with friends.
Yeah.
That's how I used to catch up with so many of my friends. We would just go out for dinner and just hang out for a couple of hours and just catch up on life. And I miss that. I know that eating indoors has been challenging, especially at the early days of the pandemic when there was so much spread and we didn't know what was going on, but we were seeing what was happening in restaurants. Many of them weren't well ventilated. So I know that has been edged out of a lot of people's life. And that's been true for me too, to some extent. But I do feel like I have more tools now to start getting together with friends for meals. I just can't wait to ramp that back up and for it to be like the old times where you could just call up a friend and on a moment's notice, just get together for dinner or have an unprompted get together or have somebody drop by and just serve them some dinner and catch up. Like those are the times I miss.
We'll get them back. You said that we will. I trust you on that. I'm going to hold you to it. That and a hug.
Absolutely. Happy to deliver on both.
Excellent. Excellent. So thank you so much for coming on today and talking to our moms. It really means so much to us, and to have your perspective, not just as Surgeon General, even when you're not wearing your hat, but also as a dad. It's really very special.
Thanks for having me, Heidi. And thanks for just facilitating this conversation and really for building this community. Community is really everything. It is so important. It was always important, but I think COVID has reminded us of just how much we deeply need each other and how much community matters. So thank you for what you're doing.
I've always said motherhood is the ultimate sisterhood, but I have to say, and it's true all over the world. We all share that bond of being emotionally connected because we want what's best for our babies. And that's true of fatherhood too, and just being parents in general. So
absolutely. Couldn't agree more.
Thanks so much. And happy birthday to your little girl.
Thank you so much, Heidi. I appreciate that. Thanks so much. And you take care.
Okay. Bye.
Bye.